Good evening, students. So today for CHO questions practice, we will start from a new portion, that is from the leukemia. So about leukemia and its questions with multiple choice, which comes usually in CHO exams or DSSB exams, many competitive exams. So let us see. First is leukemia. A definitive diagnostic test for the leukemic patient is, so the correct answer is bone marrow aspiration, because among these leukemic will confirm only by microscopic examination of bone marrow cells to see abnormal malignant cells. Then the second question, 227 question is gold standard in the diagnosis of leukemia is, so gold standard in the diagnosis of leukemia means which is mostly best one. So bone marrow biopsy is the best one for diagnosis the leukemia. And this question you can see has come for the Rahu post basic BSc nursing entrance exam. Then the most common type of leukemia seen in older adult. So the correct answer is chronic lymphotic leukemia. Chronic lymphotic leukemia usually occurs in people after the age of 50. So it is also called as old age leukemia. That is why it is found in older adults. The most common type of leukemia seen in children is the most common type of leukemia seen is ALL, that is acute lymphoblastic leukemia, ALL. And this question has came in the AIMS Patna nursing officer February 2020. Then 230 question, a child with leukemia having nausea should be offered. The correct answer is cold clear fluid. Means a child with leukemia and she is also having nausea, so she should offer the cold clear fluid. Why? Because leukemia patient should provide small frequent meals with high calories, high protein and high carbohydrate that require little chewing, like cold clear fluid. Then this question has come in the RUHS MSc nursing entrance, you can see. Then question 231, which of these beverages can be given to a child with leukemia if nausea occurs? Beverages, the correct answer is plain water. Plain water can be given to the patient who are having leukemia and nausea too. This has come in the IGNOU post basic BSc nursing. Then the clinical manifestations of a nurse should expect in a patient with ALL, means acute lymphoid leukemia. What are the signs? The correct answer is alopecia and bleeding gum. This has come in the RAK MSc nursing. Now the next question, its explanation is, in leukemic patient due to pantocytopenia, the anemia, infection and the bleeding disorder and the petechiae and bruising usually occur. Infiltration of bone marrow by malignant cells cause fever, fatigue, pallor, anorexia, pathological failure, fracture and bone and joint pain. Signs of cranial nerve, mainly cranial nerve 7 and spinal nerve involvement. Then question number 233, a 6-year-old newly diagnosed with acute lymphoid leukemia, during assessment which of the following signs and symptoms would you expect to be occurring? Means acute lymphoid leukemia patient is diagnosed and patient age is 6-year-old. So what kind of manifestations, clinical manifestations he will have? The correct option is A, fever, pallor, bone and joint pain. This question has came in the RAK MSc nursing entrance. Then question number 234, a patient has recently been diagnosed with leukemia. Which of the following symptoms would a nurse expect to see the given diagnosis? To see the given diagnosis, leukemia, The symptoms which may be seen are bruising, fatigue, bone pain. And this question has come in the GMCH Chandigarh staff nurse. Then you are caring for a 10-year-old with acute lymphoid leukemia who underwent a bone marrow transplant. To provide a safe, effective care environment, what would be included in the plan of care? Question number 235. So, for this, the correct answer is use of egg crater or other pressure reducing matter. Why? Because use of egg crate or other pressure reducing matters reduces the pressure on the back to help prevent the pressure sore. Other activity like rectal temperature, catheterization and not maintaining strict isolations are contraindicated into bone marrow transplanted patients. Then the next question is, a 4-year-old newly diagnosed with leukemia is placed on bed rest while assisting with morning care with nurse notes bloody expectations after the child has brushed the teeth. What nurse should do after this? The correct answer is record and report the incident without alarming the child. Yes, recording and reporting is the first work you should do. Then question 237. A 68-year-old woman diagnosed with thrombocytopenia due to acute lymphotic leukemia and is admitted to the hospital, and the nurse should assign the patient. The correct answer is nurse should assign to private room, so she will not be infected by other patients and healthcare workers. This has came in the GMCH Chandigarh staff nurse 2019 question. Acute lymphoid leukemia patient with thrombocytopenia also have leukopenia because of pantocytopenia. So, to protect the child from infection, keep the child in a private room with high efficiency in a particulate air filtration room. Then the last question is, the primary reason for using prednisone in the treatment of acute leukemia in children is that they are able to. Correct answer is suppress mitosis in the lymphocyte. This question has came in the RAK MSc Nursing 2017. Steroids used into leukemia because it without inhibiting RBC and platelet formation, it only controls the leukemic cell like lymphocytes and multiplications in ALL. So up to this was the question discussion. The next disease and next portion will be discussed in next video. Thank you class.